Hi, I'm Karen Rudicelli, Director of Health Affairs within the Government Relations team here at MOA. I'm here today to talk to you about our AiA priority on the military health system. We are looking to get Congress to require DoD to establish a platform, a digital platform, that would allow beneficiaries to report access to care problems that they encounter within MTFs. This would allow beneficiaries to get help navigating the military health system. A digital access assistance system would have two benefits. One is that it would provide direct help to beneficiaries who are encountering problems by directing them to resources to help them navigate the system. Secondly, it would provide better transparency to the types of problems that beneficiaries face, and it would also generate actionable data, which hopefully would encourage greater accountability to address problems that occur across the military health system. Access to care problems are pretty well documented across the system. Last year's House Armed Services Committee Quality of Life Panel report acknowledged that there are long-standing problems with access to care within the MHS. They cited several reports by the Government Accountability Office and the DoD Office of the Inspector General that highlight some of these challenges. In terms of beneficiary impact, this can affect patients in a variety of ways. Sometimes they encounter long waits for primary care manager appointments. Other times their referrals aren't released into the network, even though the MTF can't meet access to care standards. And sometimes it's as simple as phones that aren't answered. But at the end of the day, what this means is that people are having difficulty accessing needed care. The issue paper that we put together for this topic includes a graphic that illustrates one example of how this can play out. It shows that for a specific measure, which is the number of well baby appointments within the first 15 months of life, how many patients are getting the recommended number of appointments in various MTFs versus a benchmark. And you can see by the data on that graphic that there are several areas where it seems that there might be an access to care problem because patients are not getting the recommended number of well baby appointments. This issue is particularly important right now for a couple of reasons. Number one is that the military health system is destabilized. In 2023, the Department of Defense acknowledged that they're having very great difficulties staffing MTFs, and they can't always provide access to care for all beneficiaries. Another issue that makes this particularly important right now is some inflexibility in TRICARE policy that has occurred since 2018. Previously, patients were allowed to switch TRICARE plans pretty much whenever they wanted to. Now they have to wait for open season or for a qualifying life event in order to switch plans to access care in the TRICARE network. This inflexibility can make it very difficult for people to leave the MTF if they're encountering problems there. It's really incumbent in a system where it can be difficult to leave the MTF, that there is a robust option for reporting access to care problems. The current options that exist are really inadequate. The Defense Health Agency, Department of the Inspector General, lists out the options for reporting access to care problems, and it starts with the patient advocate, which we've heard may or may not be able to help in many instances. If that isn't resolved through the patient advocate, the next steps are to go to MTF leadership. And these really aren't viable options, particularly in a rank-based environment where people may not feel comfortable going to MTF leadership with access problems. Some of you may be aware of AiA, or the Interactive Customer Evaluation System. That system might be the basis for a solution here, but the way it stands right now, it's not a full solution. The way that complaints that are submitted to AiA are handled really varies by installation, and it's unclear if that information is reported up to leadership so that systemic issues can be addressed. Of course, the Defense Health Agency does surveys of patient satisfaction, And I'm sure these provide valuable information, but they aren't the timely sorts of assistance, and they can't provide that to patients who are experiencing access problems in the moment. As you go into congressional offices to talk about this, it's important to understand that there are precedents for this type of system. When the housing crisis occurred several years ago, where military families were facing problems with rodent infestations and black mold in their housing, and that hit the national news, when Congress increased their oversight of housing, one of the things that they did is mandate a digital system where families can report problems with their privatized housing. And that's up and running now. A system that's a little bit closer to healthcare is within the Department of Veterans Affairs. In the 117th Congress, Congress mandated a patient advocate tracker to be set up within VA healthcare. It's not up and running yet, but it does require, Congress has required a system that would allow veterans to report problems and then track them through resolution via a digital platform. So this is not, what we're asking for is not unheard of, and it's important to understand that as you go into congressional offices to talk to them about it. Just to wrap it up with the elevator pitch, MHS access to care problems are well documented, but there's not actionable data out there to help address problems as they're occurring. A digital platform would provide two benefits. It would direct patients to assistance in the moment, and it would provide greater transparency to the type of problems that patients are facing so that they can be addressed, and it would hopefully increase accountability across the system. There's really two reasons why this is particularly important right now: MHS destabilization and TRICARE policy that has become more restrictive in terms of letting people switch plans to access care in the network. So what we're asking Congress is for a requirement to have DHA set up a digital platform to allow beneficiaries to report their access to care problems so they can get help navigating the system.